am Dr. Yang Yun. I am an associate professor in the Department of Biomedical Engineering at the University of Akron. The reason why I was interested in liver fibrosis is that several years ago, when I was overweight, because of my this job is one of the contributing factors. So the doctor told me to lose weight. If I don't, over the course of the next several years, my liver will be inflamed, then it will become fibrotic, and my liver may fail. I found a collaborator who had a hypothesis, an animal model, but she didn't have the means to actually deliver the drug that she needed. And fortunately, since my research is in drug delivery, I was able to accommodate and help her and collaborate and produce this research. Well, okay, so the results are very, very promising. So the problem with using RNA interference to treat a disease is that there's very limited way that you can introduce the gene into the cell. So what we want to do is take our nanoparticle, make it targetable so that it can recognize the liver cell only. So when we inject these nanoparticles into the bloodstream, it will only accumulate in the liver cells and only treat the liver cells that's inflamed as opposed to the normal liver. So we want to get our nanoparticle to tell the difference between cells that are undergoing liver fibrosis as opposed to normal liver cells. So that is probably my next area of research. So we already have a means to put peptides on the surface of our nanoparticles. So we want to find the right peptide to recognize the right cell type. So my area of research is in drug delivery. So the one reason why I came to the University of Akron was that as a postdoctoral fellow, one of the limitations of drug delivery was materials. So we were using materials that was invented in the 1950s. And unfortunately, a lot of people are using material that's already been developed. And they were developed under a set of assumptions with our bodies that's no longer relevant. So that's the reason why I came to the University of Akron, because of its polymer science expertise, to develop material for the next generation of needs so that we can develop, for example, tissue engineering material that will react with the body and cause the cells to behave in a certain way that's to our advantage. So that is the heart of my research. So in order to do drug delivery well, we need the right materials to make our drug delivery systems. So, so once we have the material that we like, then we have to process the materials in a way. So those are the area of research I think that's not being addressed very well right now. So I want to continue the polymer development route and also then apply the polymers to the appropriate disease.